Welcome to rehabrunning.co.uk, getting you back on the road after injury. Here's a tailored McConnell taping technique in under 5 minutes.
Here we go. 5 minutes, tailored McConnell taping technique. Away we go. We've marked up here the 4 corners of the patella. Medial, lateral, superior, inferior. Drawn a cross between them in order to get the centre of the patella. So first thing we're going to do is we're going to measure glide. So we're going to take the medial femoral epicondyle, take that to the centre here, which is 10 centimetres. Then we're going to go from the centre to the lateral femoral epicondyle, which is then 9 centimetres. Now McConnell stated in her paper that a 0.5 centimetre variance did exist in terms of the reliability of the test. So with it being a 1 centimetre, we take out of that variance, we've got a 0.5 centimetre of lateral glide of Jack's patella here. So next test we're going to do is we're going to assess whether it's got any tilt, any signs of tilt. So we've got a simple pinch either side here. Can we get the thumb underneath the patella as much as we can get the finger? And we can say here with Jack that that is absolutely spot on. Commonly seen within people who've got quite marked patellofemoral pain is that it's very difficult to get underneath that lateral aspect such that there's actually a lateral tilt, but that's not true here with Jack. So the final thing is that we're going to look at the rotation. Now the rotation is judged off of the long axis of the femur, and we're going to look at that long axis relative to the axis of the patella. And we can see here it's very, very slight, if anything, but we've got a lateral rotation because we're talking about it with respect to the inferior pole down here. So we've got a relative lateral rotation of that inferior pole, and this is what we're going to address with this taping technique. So we've got 2 things to hit up. We've got a lateral glide, small, but there, and we've also got a lateral rotation. And so the way in which we're going to do this, simply measure up the underlay tape. And that's just going to lay with no tension at all over the middle of the patella as we've marked up. Okay, so a lateral glide needs to be corrected with a relative sort of correction through to a medial glide. So get hold of our rigid tape here in order to do the correction. Now measure that up, rip it off. What we're going to do is no tension over the lateral bit until we get to the middle. Once we get to the middle, to correct the glide, we're going to pick up the tissue, press down with the thumb and place it down onto here. Smooth that off. Make sure that knee flexion can occur without it peeling off, so we just got to hold it as we do the knee flexion. And we can see that there's some nice crinkling that's occurring on that medial aspect. So that's done to address the glide. Okay. Then rotation, addressing the rotation. We come to this. I'm a big fan of correcting the rotation superiorly so as to not create more loading going down into the fat pad, which could be a source of pain in people with patellofemoral symptoms. So we're going to come superiorly with our next bit of underlay. Into here, size it up again, and we're saying that there's a relative lateral rotation, so we've got to actually take the superior pole laterally in order to correct that. So we start medially, we come to the midline, and we manually correct and place down, manually correct, place down, in through there, done. Job done. Has a really nice effect, secondary effect of tipping the pole, inferior pole out of that fat pad in case that's any source of irritation. We again check that we're good for flexion without it peeling off, and we're away. Then we're going to retest our marker, which is a thing that was shown to be provocative before we started, in Jack's case a single leg squat, and we're going to assess to see whether that has reduced by over 50%. If it has, it's successful. We'll leave the tape on and away he goes. There we go. Tailored McConnell taping in under 5 minutes. Done.
You've been watching rehabrunning.co.uk, getting you back on the road after injury. A tailored McConnell taping in under 5 minutes.